Hey there, it's Susi Hately with Functional Synergy, and this is a video series for people post-knee replacement, and they are ready to take on more strengthening, and they've got the okay from the medical team to do so. We're going to be moving from your back and up into standing, really working on better movement patterns, better neuromuscular patterns for your knee, your ankle, and your hip, so you can get the most out of that knee replacement and really get back to the things you want to get back to. So what I've got here today is you'll need a pillow or a bolster, a block, and the theraband. We're going to begin with taking that pillow or that bolster underneath the legs into a position where we are coming into what we call in yoga, Baddha Konasana. And this is a yoga-based program, so we use awareness, mindfulness, breathing, and gentle movement to really help you along with better mobility and more strength and, of course, stability. So again, you really can get the best out of that knee. And so let's begin here, just settling through the front of your hips, settling your breathing. And it's a great idea whenever you begin a set of exercises, whether they are traditional rehab exercises or yoga-based or Pilates-based or fitness-based rehab type of things, is just to connect and notice your state. Yeah, sometimes our days can be a little bit busy and we can lose touch with ourselves. This is one way to connect back in. And then bring the legs up and bring one leg to your belly. Now, as you're bringing one leg to your belly, notice your pelvis. So as you bring that leg in, we're not falling backward and flattening the back. We're just moving that leg bone in the pelvis. Good. And then other side. Good. And then come back to the first side. Bring the hand to the front of that knee and press the knee into the hand into the knee. So you're engaging through the front of that hip. But that pelvis the entire time has stayed quiet. Great. And then other side. This is an isometric hip flexion exercise. Really lovely. Okay, and then bring that down. Okay, let's take the ankle onto the knee. And as you're doing that, make sure it's really that leg bone is moving into your pelvis. So if you need help, bring that leg straight up, rotate that leg bone, and take the ankle onto the knee. Bring your hand around to your bum, to those lower fiber glutes and rotators, and start to move that leg bone away from you. And you can take your theraband and place it around that leg and then press that leg into the theraband. So this is now a bit more load, so a little bit more strengthening to your bum, and soften through the front of your hip as you move that leg in the hip socket. So as the leg presses away, the front of the hip is quiet. Okay, good. Then other side. Now as you're doing these, what's important, leg comes up, rotate, let that foot come down onto the leg, theraband around, and the leg pushes away. Thinking of how your lower glutes and your lateral rotators are moving that leg bone. And watching if there's anything straining through your ribs or your jaw, keep the focus in on that leg bone. Okay, great. And then let that go. Take the pillow away from you, but on one side. And we're going to hold that theraband close by. We're just going to take a little bit of a twist towards that bolster or that pillow, and then come back up. So the shoulder girdle stays where it is. It's just the pelvis and the legs that are moving. Notice that bottom foot, if I show this here, is not sliding midline. You're just coming onto the outside edge of that foot. And you might find that you just go as comfortably as far as the pillow, or you might need to even bolster up more, depending on how you're feeling. Okay, now with the theraband, Press that theraband, the leg, into the theraband. Remember, no hip flexors, those are quiet. And now with that leg pressed out, now take the twist. And then come back up. Now what's really cool about this movement is that you're utilizing those rotators to keep the leg wide, like to keep the leg into rotation. And then as you come back up, you're utilizing your abdomen, not your shoulders and not your ribs. So you're getting a nice focus on your abdomen and on your rotators of your butt. And it's going to really help the stability through your body, help that knee become better and more functional. All the while tuning into your breathing. Okay, good. And then let that go. Okay, just bring that bolster to the other side. And then gently move that leg initially, ankle to knee, and then take that twist. And then bring the theraband back around. Press that leg bone into the theraband and rotate. Again, those hip flexors are nice and quiet. Perfect. Okay, nice. Now let that go. Slowly roll it over and coming up. And we're going to take the theraband again, and we're going to bring that theraband around the legs. And we're going to come into a wall sit. And from here, just come into a very, very gentle wall sit so that you can be here for 30 minutes. Not that we're going to be, but you could be here for 30 minutes if you need to be. So you're super comfy. Feel the bottoms of your feet, 3 points, the center of the heel, the ball of the foot, and the base of your pinky toe. And press your legs wide into the strap. So you're moving the legs wide. And then take your hands to the outside of your hips and in around your bum. And while I don't want you to squeeze your bum, I want you to feel how your bum contracts when you move your legs wide. It's not going to be a big contraction. It's a very low tone, but there's a little bit of activity down there. Now, sometimes this can take a little bit of time to come on post-surgery, particularly since it's probably correlated to what was creating the need for the knee replacement in the first place. But this will come with a couple of other exercises that we'll do today. This will start to grow, this new pattern. Okay, lovely. All right, so let that go. Come on up. And we're going to take that theraband away. Okay, now bring the legs wide and then rotate the leg bones. This is a really great one. Being goddess, take your hands to either side of the legs. Now push those legs wide. Okay. Feel the 3 points on the bottom of your feet. Center of the heel, ball of the foot, base of the pinky toe. And focus in on moving the leg bones in the hip sockets. There you go. Now when you're doing this, of course, you don't want any pain in your knee per se, like a grating pain. And as you come to stand, you want to be able to feel like some freedom and a sense of lightness in through your body. Okay, let's bring the block back in. And we're going to do some heel squeezes here. And the heel squeezes, what are really cool about the heel squeezes I find, is that you'll see here that it's truly the heels that are on either side of the block, not the full foot, just that heel. And you're going to press your heels in, and it's a gentle press. It's a little subtle, but what I want you to notice is if you bring your hands down to your lower bum, as you press those heels, you'll feel that lower bum contract. What you don't want to contract are your hammies, your hamstrings, or your inner thighs. Then we're not quite doing the movement the way it's intended. You don't want to feel any soreness increasing in your knees. It's all in your bum as you press the heels. What's great is it brings alive this connection between your feet and your hips. Good job. All right, let that go. All right, so now from here, you can bring yourself up onto your block, hold the wall if you need to, and from here, just swing your leg forward and back. So we're not driving this from your back like this, but rather thinking about your hip socket here and your leg bones swinging here. Yeah, don't be surprised if your toes start to touch the ground because that's some release happening. Try and keep the knee straight. Okay, and then come off. Take a moment here and just feel what you feel. And then other side. And swing that leg. Feel through that hip. Keep your torso quiet. All right, lovely. And now from here, now stand and feel. Okay, so now we're gonna come here to the mat that you're standing on or here in this space of your mat. Bring one foot behind you and let the toes be very, very light on your mat. And then very gently go through a one-legged, small squat and then up. Okay, now take your hand to the outside of the thigh, press that thigh out, be aware of your ribs to pelvis, and keep the movement through the hip, the knee, and the front ankle. So the back toes are just for balance, and you're not swooshing down. So really just kind of keep the connection between your ribs and your pelvis. And if it helps, take your gaze about 5 feet in front of you. Keep it gentle. And also notice the 3 points on the bottom of your feet. Center of the heel, ball of the foot, and base of the pinky toe. Good. All right, other side. So bringing the weight over, taking the toes back, and begin to move. Now, if you want to press that leg into your fingers, that can help if you need it in terms of connecting with that outer hip. Feel the 3 points on the bottom of your feet. Whoops, I'm a little unbalanced here today. Good job. All right, then stand and notice what it is that you feel. There you go, you're on your way. You're on your way to getting back into the movement that you really want to be doing and getting back to life. So if you've enjoyed this and you would like to experience more of this, there's 2 things. Subscribe and hit that notification button, but also look in the description. There is a knee program that you can access and get more and more of these sequences and exercises and a lot of the science about really great results that you can have so you can have a long-lasting knee replacement. All right? We will see you next time. Take good care. Bye.